I'm doing unilateral AP oblique modified cleaves method. The IR is 14 by 17. It's going to be crosswise. You are going to be using a grid. The SID is 40 inches. You want the patient supine with the center of the ACES of the affected side on the midline of the grid. So this would be the approximate area of the ACES, and this is the affected limb that we are using. So overall, you would want the ACES to be in the middle of the grid. You want the patient to flex the knee of the affected side and draw the foot up to the opposite side of the knee. This image does a horrible job at showing that, but this is the best image I can find. So this is what we're going to be working with. But in the real world, you want this foot to touch this knee. You're going to have the thigh laterally abducted approximately 45 degrees. This would then make sure that the pelvis is slightly rotated. You definitely want the pelvis rotated, as this is an oblique projection. For the centering, it's going to be perpendicular at the mid-sagittal plane, which is 1 inch superior to the pubic symphysis. So this is the pubic symphysis. 1 inch above would be around here. So the perpendicular centering is going to be right in this area. Breathing instructions. I'm going to suspend breathing just to make sure no anatomy is being moved while exposing. For the collimation, again, it's going to be 14 by 17. And you're going to collimate to about 1 inch beyond the shadow of skin, depending on the size of patient that you have. Really depends on that. But here you have the marker. Marker is a safe spot away from anatomy. KVP is 85. Mass is 28 on a CR and 14 on a DR. For the structures that you want to see, we are looking at a unilateral projection. Therefore, we are only using one limb. So we want one femoral head, the neck, and the trochanteric area. This positioning would be of a suspected fracture or some type of pathologic disease. And for the criteria, you want the lesser trochanter on the medial side of the femur, the pelvis to not be rotated, and you can make sure this is so by making sure that the ACES on both sides have an equal distance from the tabletop.